Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome, everyone, and thank you for tuning in to our weekly podcast, Redefining Medicine. We are very pleased to welcome Dr. Cristina Persa, a naturopathic physician originally from Transylvania, Romania, and now based in Washington. Welcome, and thank you for joining us, Dr. Persa.
Well, thank you so much, Lindsay, for inviting me. It's really a pleasure to be here.
Thank you. So let's get started. Dr. Persa, after receiving a degree in medicine in 1996, you went on to gain a degree in naturopathic medicine in 2003. What drew you to pursue this particular training?
Well, yes, I earned my medical doctor degree in Romania in 1996. And upon completion of my residency in clinical pathology, I was fortunate enough to be awarded a scholarship from the University of Nebraska. And then I moved to United States. And while I was working on my Master of Science thesis, I did research and studied the biochemical mechanisms of age-related cataract. And then later on, I continued my research in glaucoma at the University of Arizona in Tucson. And after so many years of working in research, I started to miss the life of practicing physician and to have the opportunity to be close to patients, for which initially I was trained for. And I decided to do something different. And that's something to allow me to have a more comprehensive and holistic approach, and to allow my patients to choose the best therapeutic modalities for their needs, be those natural, conventional, or both.
In 2018, you completed your fellowship in anti-aging, metabolic, and functional medicine with A4M. What inspired you to pursue this education?
Well, functional medicine is evidence-based holistic medicine and provides a common language and a unified model to allow integrative approach. A4M is offering the most up-to-date clinical training in this field. And I've been with A4M since 2014. And since then, I attended every year, at least one or two conferences, workshops, any kind of, clinical training they offered. I don't think I would be able to practice this kind of medicine without A4M. And not only that, but also to be very successful in what I'm doing.
What module or particular aspect of the fellowship has the greatest impact on your practice now?
Well, 50% of my practice is focusing on hormone replacement therapy. So module 1, endocrinology, had definitely a huge role in my practice, because it allowed me to best identify, test, and to treat the hormonal imbalances and dysfunctions. I also enjoyed module 5 with clinical intensives, because it delivers the cutting edge information and allows us to approach the more complex cases and patients.
In 2019, you opened your own medical practice, Persa Functional Medicine. Can you walk us through the journey that led you to this point?
Opening your own practice can be very challenging. I run a 100% cash base. At the time when I decided to open my own practice, I accumulated enough experience in the field of functional medicine. Actually, I need to say that I was fortunate enough to work in the clinic of one of the most recognized doctors in nutritional medicine, who is Dr. Jonathan Wright. And working with him, I accumulated a tremendous amount of knowledge, and that made me very confident to be on my own and take the practice of medicine in my own hands. I also built a strong practice, and most of my patients were following me. And that was really very helpful because, when you open your own practice, most of your concerns are, okay, how patients can find you and how difficult would be to keep your doors open. When a patient come to see me or any general functional medicine practitioner, they've already went through so many other doctors with insurance, and their health didn't improve, and they really try to find something new, maybe a doctor who is able to spend more time with them and listen to their concerns and analyze that information. There is no way you can do this kind of medicine and work for insurance company when they kind of force you to practice in a certain way, and making sure that you are ordering only certain labs. If the patient wants to use their insurance and pay for the labs, the insurance will not cover. And you just cannot dismiss that testing because they don't want to cover, when those testings are very important to have a correct diagnosis. On the other hand, the expense may be higher in the beginning. First visit, second visit, when you have, to invest money in testing and, medication or supplements. And then as you get better, you won't need to spend so much money, and you don't need to see the doctor. The results are the most important thing. If they get better also in a reasonable amount of time. So in my own experience, I have results at 2 months. People feel like, 70-80% significantly better. So far, I'm doing great, and I'm very happy.
Thank you so much, Dr. Persa, for sharing your insight and expertise with us today.
Thank you.